So we'll make a start. Good morning, everyone. I'm Jeanette Williams, Interim Head of Staff Experience for the Southeast region. And I have my colleague Carol as well, who's sharing that role with me. And then we have all, did you want to say anything, Carol?
No, thank you very much for the introduction. I share this space and work with Jeanette. I'm also a regional equality, diversity and inclusion program manager in the Southeast region. Thank you.
Thank you. And we're part of the bigger looking after our people team. And we have Christina, who you would know, who does all the communication with you. But today's session, we really wanted to give it over to sharing some of the wealth of the work that's going on across the region. And all of you helped to co-design the session by the questions you asked. So you were asking us about what are colleagues doing around recovery? What are colleagues doing around socialization? So each of our colleagues will have 5 minutes. Then you will be able to put questions as you go along in the chat box, but we will pause and we will ask you to direct your question to the particular colleague. And then we will hear from Dr. Katrina Lake around the mental health hubs, because you asked us a myriad of questions. And some of it we were able to answer, but some of it we felt that we needed expertise in the space. So the agenda would be, we'll have Angela Rayner first from CCAM, then we'll have Catherine Cox from Sussex Partnership, then we have G. Richards from Dartford and Gravesend, we will have Eric Barrett from Kent and May, and we have Ros O'Neill from Oxford Health NHS Foundation Trust. So we have a packed agenda and we're going to go straight into it. And if you've just joined, welcome. And thank you. And without further ado, I'll hand over to Angela.
All right. Good afternoon, everybody. Yes, I'm from South East Coast Ambulance Service, and I've been asked to talk about top 3 things to support staff to recover, which for us is quite difficult to just pick out 3 things, because we're very fortunate that we've got an in-house wellbeing hub, which provides a full range of wellbeing services via a single point of access. So all mental health and physio referrals come to us. We manage trim, alternative duties, an active service directory, provide information and education materials, regular bulletins, workshops such as sleep and nutrition, Slimming World, fitness activities, etc., and very much engaged at the moment in post-pandemic planning. So when I tried to think of 3 things, I thought I'd very quickly just talk to you about three items. One being alternative duties. We do have a well-established alternative duties process where we try to keep people in work or get them back to work as quickly as possible, utilising alternative duties. So we manage that process, and we've introduced a specific pathway specifically for COVID reasons. And this was required because some of our policies at the moment mean that you can only stay in one alternative duty role for up to 13 weeks before being moved on to another one if you require duties beyond that date, and also that you could only have a phased return up to 4 weeks. So we know that with long COVID, etc., and people shielding, that we needed to review that. So we have a special pathway 3, which is a COVID pathway, specifically to make sure that we keep as many people active and gainfully employed as possible, stops lots of mental health issues developing, and just maintains people's confidence as well in returning to the workplace, as well as what they learn. So this links in with some work we're doing with ROH to develop a specific COVID return to work assessment, whereby anyone returning is given an advice leaflet on with long COVID advice as well. So that's that one. Also, we're developing a range of psychoeducation videos to support the existing prevention and education information that we've produced. And this sits nicely alongside our physical exercise videos, etc. So the ones that we're working on at the moment, they're 5-minute videos. One is understanding PTSD and trauma-focused therapy approaches. So that would cover things like EMDR and trauma-focused CBT. The other one, understanding sleep. then understanding stress and anxiety, and then one understanding depression. We hope to have those finished by and available in May. We are also then the last thing I just want to focus on is getting back to the fact that we've actually got this hub. We're focusing on the fast track access to treatment, which means that any member of staff referred for mental health support will have an assessment within 10 working days and then go immediately onto specialist support pathways if they're required. And we don't just then leave them with whoever's providing that treatment. We look at a holistic approach, so very often bringing in support where appropriate. For example, a member of staff in crisis recently was actually homeless and living in his car. We were able to get him into support pathway, but also get financial support via charitable funds to get emergency accommodation for him while we sorted out and supported him to get something longer term. Then we're able to put him onto another charity that was able to support longer term financially, etc. So we're focusing on making sure that people have access to that support and just supplementing it with facilitating coffee mornings, drop-ins, providing some meditation sessions, etc. Before we take it to the next step for the post-pandemic planning. That's it from me.
Wow, thank you so much, Angela. So much work going on in that space, and exciting, and the compassion that's shown to colleagues as well. So thank you.
I'm Giovanna Richards. I'm the Mental Health and Wellbeing Manager at Dartford and Gravesham NHS Trust, but everyone calls me G, so just G will do. So I just thought I'd talk about 3 things that we did when the pandemic started last March. So I was in my role then as core skills trainer for the Trust, teaching conflict resolution and managing challenging behaviour, when I was stood down obviously from teaching because we went into critical incident and we weren't allowed to deliver training. And I was grabbed by Leslie Ann Osborne, who you all know, who's my now manager, and said, G, we need to get some stuff done for staff. We need to create some wellbeing spaces, have a think about what you can do to support the staff right now. So this is very reactive. So I created a space in one of our training rooms called the Wellbeing Lounge. It's not very inspired, I know, but basically we emptied it of its table and chairs, went beg and borrowing to John Lewis in Bluewater, who delivered us loads of bean bags and comfy chairs and candles and soft music and lots of lovely things. We created it into a really lovely, relaxing space, like a spa room almost. And at that point, I noticed there was a lot of staff coming into that area crying and that were really distressed. And a lot of them would sit on their own with nobody to talk to. So I got together with a couple of colleagues and we created the Time to Talk team. Now, all we were people with hopefully good active listening skills and compassion and empathy. And we based ourselves in that room just so staff could come in and decompress and have someone to talk to in confidence. What's happened with the Time to Talk team now is it's grown and it's developed and it's been redesigned. So I now have a team of volunteers who are rostered on to provide 7-day cover for staff and to provide compassionate and active listening. Most of my volunteers, obviously we all have day jobs, they provide an hour or 2 a week dedicated for any referrals that come through our Time to Talk inbox, which we set up last March. And most of them have mental health first aid training. I've got 2 counsellors, qualified counsellors on the team, and 2 RMNs as well. And basically what we do is we provide confidential support to staff who need us, but we also signpost where appropriate. So the team know that they're not there to give advice or counsel. They're there just to provide active listening and compassionate support. And we know how to signpost to other more specialised services. Going forward, out of this Time to Talk team, which started off with just 3 of us, sitting in our Wellbeing lounge listening to staff. We now have trim training going forward in April. So the volunteers will all have mental health first aid training in March if they haven't already done it, and in April they will all become trim trained. And out of this Time to Talk team, I'm going to develop an instant support team. So if we ever have anything like this again, or we have a major incident, a serious incident, or a critical incident on one of the departments or in the trust, my trim trained volunteers can deploy on site straight away to support staff. So it's kind of out of that tiny little very reactive acorn last March, has grown this team now of 14 people that are very dedicated, very supportive, and all the staff know where they can go if they want immediate support in confidence. And going forward, they'll be trim trained and forming an instant support team to look after our staff. So that's one of the things that we're really quite proud about. I think the other thing that has developed so well and a real positive out of the pandemic is communications. So we all know that if you're not told what's going on, you speculate and rumours start. So it was very clear right from the beginning that our comm strategy needed to be on point. And what happened was the chief exec started to deliver a podcast every day to staff with the updates, the raw facts. So how many deaths we had that day, how many COVID patients we had in the trust, but also really positive things. So shout outs to particular teams and members of staff who'd been nominated. And that was a really important way of keeping the whole trust and all of the staff completely up to date with what was going on a daily basis. We also had a daily update at the end of every day with offers of support, donations, what was going on, podcasts to listen to about sleep. We had meditation, and we also set up wellbeing bulletins. So our wellbeing bulletins are Mental Health Monday, Wellbeing Wednesday, which encapsulates physical and mental health, and Finance Friday. So that's about advice and support around financial food banks as well. All the stuff, we have a lot of staff that are suffering hardship at the moment. So the communications throughout has grown and developed, and it was really important to keep staff well averse with everything that was happening and developing in the trust through that critical incident. And then just finally, which I think is a really lovely thing, was our community support. We had so many donations delivered to the hospital, all sorts of things, food, drink, but one of the loveliest things was children who painted pictures for us for Christmas that we put all down our corridors and all around the wards. We laminated them and we put children's pictures of Christmas trees and snowmen and stars all around the hospital, and it really lifted everybody's spirits. Just a small thing, but it meant a lot. That's me.
Thank you, G. Thank you for sharing all of that in such a short space, but it also gives us another dimension of what's happening in the region to support our people. So thank you. And I will try and bring Katrin back in.
Hi, can you
welcome back.
Nina? Thank you. That was really interesting listening to that. Thank you. So I'm Catherine Cox. I am one of our joint health and wellbeing leads at Sussex Partnership Trust. So we are a mental health trust for Sussex and parts of Hampshire, inpatient and community services. We've got over 200 sites, so we're very widespread. And some of the things we've been focusing on, really using our champions. So we've got 70 employee wellbeing champions all across the trust, and we've been using them to things like increase our reach of our Wellbeing Wednesday bulletins. So many of them say that they take the bulletin and they take it to the team meeting and talk about what's in it and talk to their colleagues about what's in the bulletins, making it kind of more live and recommending things. We've got regular network calls with those champions now where we can share updates with each other and find out what's happening in different parts of the trust. And they recently helped me, about 30 of them took part in some focus groups to look at what we're going to put in our bid for the NHS Charities Together money. And the things that we came up with together using their feedback was to really focus on improving our rest break areas. As I said, we've got over 200 sites, so we're very, very widespread, but we're going to do a project, and I'm working with our capital projects team to match fund the money to improve our rest break areas, so that it's a kind of legacy for that money. And we are hoping to fund for every away day. We've got a real commitment in our trust, and we have for the last few years, to for every service area to have an away day, whether they're happening virtually in the foreseeable future, or when we can do real person events again. So we're going to fund hopefully for every single away day to have a kind of therapeutic / wellbeing type session, whether that's, you know, an artist coming in to do an art session with them, or and they can choose what they want to do and get funding for that. As well as hopefully providing alternative therapies to go into our sites. And we already do some of that, but we're hoping to really increase it, especially in our kind of frontline ward areas. What we found during the pandemic is different parts of our trust have really got more involved in health and wellbeing in different ways. So, for example, one of our clinical leads is now leading on the Staff in Mind service, our regional mental health support for staff service. We've got one of our lead psychologists who usually does the debrief post-incident sessions, and our research and development colleagues. So what we've done is bring people together. We've set up a clinical academic group to bring all the different colleagues together and look at things like sharing the feedback from the staff are raising within this new Staff in Mind service. They've had over 350 referrals. Now Katrina's going to talk about this in a bit, but we're going to really hopefully look at the themes that people are talking about and utilise that to look at our health and wellbeing activities and make sure what we're providing is really reaching the people who need it the most, as well as trying to make sure our activities are, you know, research-led, looking at research-led discussion at the last one about the CISM model that we used to use that isn't really appropriate for doing virtually, and we're hoping to use all of our existing facilities to facilitators to provide trim instead in the meantime, because I think the research looks like it's slightly better to do virtually. So we had a discussion around that. And the last thing I just wanted to talk about really quickly was prevent. So if you could go on to the next slide. And I keep coming back, when we're thinking about our health and wellbeing activities, I keep coming back to this model that I found really helpful. It was a talk from a few years ago that it was someone from a health and safety executive forum, and he said health and wellbeing activities can be split into three circles that promote, so kind of promoting health and wellbeing, you know, sleep and exercise and healthy lifestyles. It's kind of easier to promote and perhaps more difficult to evaluate. The support that I think we're all doing a lot more of at the moment, you know, this mental health extra service, the particular support for staff who are experiencing difficulties and difficult times at the moment. And for me, is this prevent circle that is obviously the more difficult to do. And I'm interested in there was a Michael West paper released, I think, in September on the King's Fund site that talks about different cultural factors that really support nurses going through the current times. So we've circulated that and having really good discussions around that with our HRBPs around what we can kind of implement in terms of staff working cultures at the moment. And I'm really interested in the webinar that Jeanette released, was on the list that Jeanette sent around, the Start Well and End Well, psychological safety. So I think some of these things, thinking about how we can prevent, I guess it's the way in which people work, isn't it? I think that's me. Thank you.
Thank you so much, Catherine. And despite our challenges with the IT, fantastic, and it just showed us a different dimension to the support that's happening across the region. And I quite like the emphasis on evaluation as well, which hopefully I'll update at the end today. Thank you. So I'll bring Eric in. Eric from Kent and Medway.
Hello, good afternoon. I'm Eric Barrett. I am the Health and Wellbeing Lead at Kent and Medway Partnership Trust, and I'm going to talk about the 3 initiatives I'm going to talk about. First of all, I'm going to talk about the Virgin Pulse Go initiative, and so this is a fun and personalised wellbeing program that harnesses the use of friendly team-based competition to help build up healthy habits, and ultimately it's getting people more physically active during the working day, and also for those who are working from home. So you also get a free activity tracker in the post. I'm wearing mine at the moment. And this Thursday, the whole organisation, all the staff that signed up, we're starting on the Destination Go challenge, where we're in teams of up to 7 people, and we're collectively trying to compete against our colleagues to ultimately travel the biggest distance. And it's going to be going on for quite a few weeks. And so just an example of some of the feedback we've got, one of my colleagues tweeted, a great day to be starting our journey with Virgin Pulse Go. Joining my team and linking up with friends online, and also I'm starting my diabetes journey. Only just got diagnosed, so feels like such a gift. We'll also be starting the heart and cholesterol challenges also, so that's really exciting, and we will be feeding back to this group about how that goes with an evaluation. The second initiative I wanted to talk to you about was our recently launched Winter Wellbeing Fund. So like a lot of colleagues on the line, we're quite a spread out organisation across the whole of Kent and Medway. We've got up to 100 sites, and so tailoring our health and wellbeing offer to the needs of individuals is really challenging. So what we've launched is a programme where every staff member is to be receive up to about, I think it's £15 per staff member into a team budget, and they can all decide about how that's best spent to support people's well-being. So for some people it may be improving their staff room facilities, getting some proper coffee in and some snacks and treats, whereas for colleagues who are working from home it might be subscriptions to maybe magazines or vouchers or something like that, just as also a bit of a pick-me-up for people at this challenging time as well, and that's been received really positively. And like some of our other colleagues as well, like G and Catherine mentioned about Wellbeing Wednesday, I feel like that's been a really effective tool for us, having a consistent newsletter that's going out to help promote our activities that are available, and also a lot of the initiatives we're made aware of through this group and other groups is really promising. So one of our colleagues wrote back about last week's edition, who's a clinical psychologist, just saying thank you for these weekly emails. These are one of the few circulars I always read from start to finish, and always full of absolute gems. I have been totally surprised with everything that's on offer. It's really refreshing. So far I've signed up to the yoga therapy, the Virgin Pulse scheme, and also definitely going to be taking part in the mindfulness Zoom sessions. So it's a really useful tool to getting that out there. And finally, just about the health and wellbeing advocates. And as Catherine was saying, it's about using our advocates to help share those messages and to get to those staff who don't necessarily have access to their emails.
Thank you, Eric. I'm so you can tell I'm getting very excited now, coming to Kent and Medway and the practical stuff that's happening, but the narrative that's coming from staff, that is part of the whole evaluative process. So thank you, and we're excited about what's happening in Kent and Medway, so thanks. And now I'll hand over to Ros O'Neill.
Hi Jeanette, thanks for that. I'm Ros O'Neill, I'm Head of Health and Wellbeing from Oxford Health NHS Foundation Trust. Now, part of the work that we have been doing, more in the recovery, and we're trying not to use the word recovery, we're trying to use the word restoration, because what we found in the first phases we were coming out of COVID is a lot of the senior managers seen recovery as a start and an end, as in an example would be health and wellbeing was down for 0 to 3 months. Everyone should be perfect and back to what normal was. So we're trying to push the word restoration. So for us, one of the key things is we're still feeling that people who are shielding or working from home with no social contact with their colleagues are really struggling. And I think they've been struggling all the way through, but now they're actually starting to have the confidence to say, I don't quite feel right and I might just need a little bit of help. So what we have done is we've set up some common rooms to try and bring these people together and where they can start to open up, talk freely. And again, just making sure, having the conversation that yes, the majority have access to the internet, but what we've experienced is when they're starting to get a bit low, they're not even looking in the internet. Whereas if you can set up a Teams call or a common space where everyone can come, you can be pointing out where the information is. And part of that we've done, we've also been utilising a document that we had produced with the first wave, which is based on the thriving and striving at work. And it's actually called for long-term absence. But within that document, what it does is it starts to get people prepared for the thought of coming back to work and how they can keep themselves active and interested whilst they're in the confined space. And we've found that really helpful. And then what we've done is we've sent the mental health toolkit, which is again gets them prepared to have the conversations and also for the line managers to be a bit more empowered to have these conversations. And we have found that really useful, mainly because it gives both the employee and the manager the confidence to have the conversations, but it's also proved to be quite a strong foundation as we start to introduce the wellbeing conversations. It's not been as much as of a shock. Now, one of the other things that we've been looking at is obviously the psychological input and support, and we've been doing that all the way through. Now, we've been very lucky, we've had some money through and we have set up the Mental Health and Wellbeing Hub, and our one covering our area is called You Matter. And the way it's been packaged is it's another service you can go through. It's just like dropping in for a cup of tea. You can use a pseudonym if you want, and we've found just the two key things, going for a cup of tea and you can use a pseudonym, has been fantastic and folk are really utilising it. And what we've also made clear is, you know, you might go in there and just have a cup of tea with and you might not need any support, or you might need just signposting onto something like the EAP or something else that might help. And one of the sort of key things that we've found really helpful is that pseudonym. We've had a lot of people come back and say, do you know what, I've accessed that, and there's been some significant things revealed in the amount. I think it went live the beginning of February, but there's been some significant things, as I say, that's been revealed that as an organisation we really need to look at, and some almost serious incidents, but there's no safeguarding issue because we've checked all that. But would they have came to light if we didn't have this service? I'm honestly not sure that we would have. We also do things like, we used to have a debriefing service, and we've changed that during COVID, and it's the post-incident psychological support, and that has proved invaluable. And again, it's gone in 2 teams. It's been looking at, so we do focus groups anyway, but what we've started doing with we call it PIPs, is going into maybe like all physiotherapists, so it can be profession focused, or it can be banding focused, or it can be one-to-one. And on that basis, what we did, we set up a single point of access, which is our health and wellbeing inbox. And what we did with all the specialists throughout the psychological support is we have a clear flow chart. So it's usually myself and a colleague that is the only access to this inbox. And if we feel we can't quite deal with what's coming in, or it's a bit complex, we have where we can go for direct support, and we don't use the word fast track, priority access for specific situations, which again has proved invaluable. Now, part of the other stuff that we've been looking at and we've already put in place is this thing around manager support. Because yes, we've done the restrooms, and we've brought in 5 porta cabins actually that we kitted out within our trust, just to make sure that we had specific areas where there was white goods that worked and rest, and where folk could get away from the ward situation. So that they're all up and running, and our charities have done fantastic work in relation to food and goodies going out to all the organisations, and hand cream and lots of little different things. And we've also provided, since there's been an infection control risk kind of dated back to the Christmas period where folk were sharing chocolates, what we now do is, with the charity money, we do stuff online. So we have this fantastic programme where folk can book in, and it can be out of hours, it can be at the weekends. You can do art, you can make pottery, you can do dance classes, you can do live cooking on the web. It's absolutely brilliant, and something we never thought would take off, but it has. We also do weekly chief exec webinars where they'll have, obviously, the chief exec. At the moment, it's been driven by people around the vaccines. So we've had Andrew Pollard, we've had researchers on there, but every week there's also an element about wellbeing. And yes, sometimes you feel you're saying the same things, but it's getting that message out there. So in relation to the managers, sorry, I kind of jumped over that. What we're looking at is, again, this empowering the managers to give them as much information and support and free them up to actually be that delivery model for themselves and their staff. And to that end, what we've done is we secured some money, and we've actually got our first cohort in March for restorative just culture. And we've done that across the Bob area, and we've got folk from every organisation starting in March, and again a second cohort in September. We've also secured money for trim, and again we've taken that approach across the Bob area, and the cohorts start in May. And the last thing we've done is the mental health first aid, but virtual. And again, we've not quite established what the dates are, but they will be across the summer months. I think that might be, one more thing that I do want to say about this delivery model. When we are doing evaluations, and we've actually got the academic health sciences in helping us across the Bob area. So this isn't just my trust, but again, it's about, we know everyone's done fantastic work. We know the national team's done fantastic work, but whatever we've done, sometimes it's just not getting to people, because some folk don't even know we exist, or they know we exist but have not got a clue how to get to us. So we're looking at putting in this external platform, which, you know, we're working consistently with them. Hopefully it'll be up and running within the next 2 months. But it's where folk can download it onto a non-work related device, as in their phone or their watch, and then they will have direct one door, simple logos where they want to go to look at health and wellbeing. I think that's enough. I'll stop talking.
Thank you, Roz. That's excellent. And I know that you didn't only cover your organisation, but you covered a lot around the system. And it's good for colleagues to hear that, for the wealth and the depth of, because everyone is an individual. And I know you're trying to cover all the different nuances and needs within the system, not just a single organization. So thank you. So we'll just pause here before we bring Katrina in. We have a few minutes for questions. I will check first with Penny and Christina. Are there any specific questions in the inbox, and who is it targeted to?
There aren't any at the moment, but that doesn't mean to say that people won't have any queries or any questions. I think I've seen a lot of people sitting there making notes, so it may be the case that people are just digesting information. But if anybody has any queries or questions from this session today and they want to email me, I can then I'll collect them and I will direct them to the relevant person. And then hopefully on Friday I can put those questions in the wellbeing update that I do on a Friday afternoon. So hopefully if anybody does think of something afterwards this afternoon, if you let me know, then I can direct those over as well.
Thank you, Christina. So before we move on to Katrina, is there anyone that would want to raise their hands or ask any questions? Okay, so over to you, Katrina. Somebody may have a question after Carol.
I just wanted to sort of acknowledge the brilliant work that has gone on in the Southeast. And as I was listening, I was kind of looking for different themes, and I thought that actually 3 themes, whoever was presenting, were happening here. So this is the communication, collaboration, and restoration. And it seems like, you know, everybody who's presented today has hit at least, you know, well, all of these different areas, which I think is absolutely great. Sorry, I just wanted to say that because it may help us to kind of to direct our thinking further.
Thank you so much. That was so helpful to really crystallize that. And Catherine, did you have a question?
Hi, yes, please. The lady who was on before me, I'm sorry, I can't remember her name.
Angela.
And
yes.
she talked about the Time to Talk team that she'd set up.
And
G.
Yeah, sorry.
Yeah, it was really, really interesting. And I know you said it had mental health first aiders in the team as well as yourselves. And I'm just interested because I know I've been hearing from like psychology leads about you know, that methods are like psychologically safe and that it's kind of appropriate and kind of in the right way. So I'm just wondering how, you know, have you run it past psychologists or what the method is? Is it just a kind of open forum and let people talk, and then it's kind of signposting, and is it kind of from the mental health first aider sort of model and mindset, or is there any more structure to it? Yeah, anything more about that would be really helpful. Thank you.
Hi, Catherine. Yeah, so as I said, initially it was very reactive, but we have now restructured. So we have governance in terms of reference around the Time to Talk team. We also have a referral pathway for all of my volunteers to follow. So there are things that are sort of red flags where my volunteers know that they have to escalate. So we have three things where we will have to break confidence and escalate to our staff mental health nurse, and that is the threat of life, someone else's life, a threat to their own life, and also patient safety. I have actually come across all 3 of those in the last year with staff more than once. So we have very strict sort of protocols around referral and breaking confidence. We don't keep notes on the staff. We do assure them that everything that they talk about is in confidence, but we do give the ground rules, set the ground rules before we start listening. And we give those 3 reasons that we will break confidence. So our referral process, just really quickly, because I know we're really pushed for time. If a member of staff flags any of those 3 things up to us, our first port of call is occupational health. We speak to our mental health nurse in occupational health, and we escort the member of staff and hand him or her over to the mental health nurse. They're not left on their own at all. If it's out of hours of occupational health, we take that member of staff to our emergency department. We stay with them, so they're supported the whole time. We ask if that member of staff, if they'd like us to call a relative to come in. And then we contact our on-site psych liaison team to come and assess and to talk to that member of staff. If that member of staff refuses to go to the ED and decides to leave, and we believe there is a credible threat to that member of staff's life, we will notify the police. We have a duty of care to do that for that member of staff. So basically, most of the staff just stay with us for 3 or 4 sessions. They just want someone to talk to. You'd be surprised how many staff are just lonely and just have no one else to talk to. If we need to escalate, we have occupational health. Through occupational health, our mental health nurse, if she assesses that member of staff, feels they need more psychological support, EMDR, CBT, we have that on-site provision from KMPT, 1.5 days a week, and our staff mental health nurse will refer into that.
Thank you, G. Thank you. That was brilliant. Thank you. If I'll just hold questions for now, and I'll bring Katrina Lake in and take questions after. Katrina, over to you.
Brilliant. Thank you very much. I'm just going to give a very quick overview because it sounds like, Jeanette, from what you've said, there's some questions, and I think most of you are probably very familiar with the hubs, and it was also really great to hear Ros and Catherine talk a little bit about the local hubs. So I think we're all aware that these staff, so they're for health and social care, mental health and wellbeing hubs have been developed to support the mental health and wellbeing of staff. This is a relatively new development. Funding was awarded last autumn, and I have to say systems and trusts have been phenomenal at getting what is a very complex, ambitious service set up within such tight timeframes. So it's truly, I think, phenomenal what's been established so far. I mean, just to run through very quickly the functions of the hubs. I mean, in the main, the hubs aren't delivering mental health treatment and interventions. So that is largely provided by local mental health services who will work in partnership with the hubs. So one of the core functions of the hubs is in relation to proactive outreach and engagement is the kind of term we use, which really means making sure that referral pathways, working in partnership with stakeholders is there, so that the hubs are working with organisations, health and social care organisations, to make sure that everybody knows what's available, and we're also prioritising the most vulnerable staff. Another function of the hub is supporting employers and managers and teams to support the mental health wellbeing of staff. And that at the moment is particularly in relation to staff teams that we know are more vulnerable in terms of mental health. And there's been some additional funding to support critical care staff in that context. One of the most important functions is rapid clinical assessment. So this is on the basis of self-referrals, so people referring into the hub, or referrals from other sources such as occupational health, GPs and so on. All of the hubs are have developed or are developing a digital front door, so that there is a very easy way for health and care staff to know how to access that rapid clinical assessment or any of the other support functions that the hubs deliver. And the final function of the hubs is in relation to onwards referral and care coordination, as well as rapid access to mental health services for those that need it. So they are or have established local agreements in place around the referral pathways. So that would be from the hub to IAPT or local mental health services, making sure that staff can rapidly access mental health services if needed, following up with staff to make sure they're getting the right support. So again, getting back in contact with staff that have made contact with the hubs, and identifying ways of managing the complexity of confidentiality and barriers for staff. So for example, a member of staff could go to the next door hub, making sure those reciprocal arrangements are in place, as well as really critically, just building on what Ros was saying, working in partnership with occupational health and local mental health services. Just a very quick mention of something which I think some of you may be aware of, but it's a relatively new development, which is that practitioner health, which has been around for some time, supporting the mental health needs of doctors and dentists, is now going to be part of the hub pathway for staff at 8D or above or equivalent, and of course doctors and dentists as well. And this is something that staff can self-refer into, and this is really in recognition of the additional barriers that those staff may experience in terms of confidentiality. So just very quickly, because I know we really want to open up for questions, I was mentioning the front door for the rapid clinical assessment. This is a function that all of our hubs most have already developed. and the Looking After Our People in the South East website, so the website that Jeanette and Carol, yourself and colleagues have developed, has all the contact information for hubs, which is really, really helpful. And Catherine, you talked about Staff in Mind. So, for example, the online way of accessing the Staff in Mind Sussex hub, which, as you said, Catherine, has had really significant demand. You can go onto that South East website and find out how you can access it. I mean, that was a really quick run through, just to leave spaces for questions.
Thank you so much, Katrina. Very concise. And as Katrina said, we will send out again the link to the Looking After Our People website. Please have a look. We've tried to make it with specific headings so you can go directly to what you want and what you need. And some of the questions we had was people weren't sure what was happening in their area. So I know we're taking some specific questions around the hub. Angela, if you would like to come in with your question.
Thank you, Jeanette. Yes, Katrina, it's great, and I've actually attended the meeting, so I heard about the service that you've got and the hub you've got going down there. My questions are around the demand and your capacity to manage the demand, given that you're serving such a huge potential population down there of staff and other social care, etc. One of the reasons why I suppose we've got our specialist pathways in place so that we can get rapid treatment and access to the interventions. What do you find the waiting lists for treatment down there when an intervention is required and you're referring on?
I mean, Angela, such a good question. And I mean, I've been involved in some mental health surge planning developments. And if we look at the forecast mental health need for our staff, and then you look at the additional population needs, you're absolutely right. The demands on the services are going to be enormous. So, most areas are being prioritised within hubs, but that doesn't mean that there won't be challenges in terms of access, because we are moving into more demand, I think, than services will be able to deliver. So I think it's variable, but I think for staff, it's about, for NHS staff, my understanding is they're not largely prioritising social care staff, but for NHS staff, there is a prioritisation in most of our hubs. But it's a really good question. I mean, IAPT, which is going to do a lot of which is going to be meeting a lot of the mental health demand. There's been a big expansion of a workforce in IAPT that's still being pushed through. So we've got kind of rapidly expanding services, but whether they'll meet the need, I really don't know. And I am concerned. I think we are concerned about that.
Yeah, I thought so, because we have 3 full-time mental health practitioners within the trust, and we're still having to outsource a number of assessments because we can't keep up. So that's just for 4,000 staff. So I do wonder. And are you aware of any current waiting lists?
I mean, it's been interesting with IAPT, actually. What's happened is that the demand has really reduced, even though we know mental health need within our communities has gone up. So actually it has been an opportunity for a lot of local IAPT services to be kind of catching up with some of their waiting lists. Most IAPT, if not all IAPT services, have waiting lists, and they do vary. But no, many of them are under 6 weeks, but it really varies. In terms of Sussex, some areas, so I think Brighton's more impacted for waiting lists than, say, East Sussex. Yeah. So, but they are around, I think, all services.
Yeah, that makes it difficult for us as an ambulance service, because we've got so many different IAPTs, which is why I suppose we tend to refer generally into specialist pathways. But yeah, thank you very much. Really.
Thank you. Katrina, I have a question. If I'm in an organisation and I'm hearing about the hubs, where should I go in my organisation to know about them? Is it on my website, or should I go to my occupational health? Will the occupational health in the individual organisations know about the hubs?
So the national guidance and what our local hubs have been doing is really clear that it's about the partnership with local occupational health. So absolutely, those partnerships have been developed and are really critical, because the hub function can't work unless that occupational health kind of pathway is what it needs to be. So yeah, absolutely occupational health and then go to the hubs. But I think the thing about the hubs front door, it is a self-referral or referral from occupational health or GP or whoever. So it is an open door for all staff.
Brilliant, thank you. Penny, Christina, are there any other questions in the chat box before I go to the update?
None that I can observe at this present moment.
Okay, Alex, you had a question? Yeah.
Hi, yeah, sorry, I don't seem to have the function to type in the chat box this week. I
I
don't know
don't
what's happened.
either. Go ahead.
Yes.
Okay. They've had enough of us. I guess just a really quick one. Just referring back to, I think it was Roz was mentioning about working from home and I guess a focus on how to support those staff. That's something that we are kind of starting to look into now. And I guess it would just be good if there was going to be, or if anyone had any kind of key things that they could share that they were doing for their staff. I guess we've got the things like the risk assessments, the DSE assessments, and some kind of top tips. But is anyone doing anything specific that has been really useful?
Obviously, this is the start of the conversation, Alex, and one of the things we will do is connect you all together.
Perfect.
So if people aren't able to say today, then you can go to a specific person to ask. One of the other questions we're going to ask is, what would it look like for us going forward from April? So would we all want to have a community of practice and what that would look like? And again, please think about it, because we will ask again next week. Going forward, would we want to have these meetings every week or once a month or bi-weekly? So if you do have access to the chat box today, please start. If you can answer those questions, we'll be asking you those, because that's a very valid question, Alex.
Cool, thank you.
Penny, did we get any response? You're welcome, in the chat box.
Not as far as I can observe, but I have to say, regrettably, I'm one who's disabled from receiving chat together with Rebecca, Alexander.
Thank you. I'll bring Katie in and then I'll give a brief regional update.
Thanks, Jeanette. Alex, it was just really in response to you. I don't have anything that's like super helpful at the moment, but the Bob ICS, we're doing some work on flexible working, looking at what the government actually states is what is flexible working, and then we're looking to hopefully survey some staff to figure out what's important to them, how to move forward, what support they need, and then look at doing some staff focus groups as well. So we will be having something somewhere, but that work is just really in the outset at the moment. So yeah.
Amazing, thanks, Katie.
Thank you, Katie.
We've got some
Catherine,
literature. Sorry, Jeanette, we've got a literature review that I can share if it's helpful with people. Yeah.
Yeah, that would be great. Thank you.
I'll send it to Jeanette and you can send it out if you deem correct, Jeanette.
Oh, thank you, Katie. That will be brilliant. And we have Christina as well. I know everybody can't see the chat box. If there's anything as well, can you send it to Christina? You can put the email in the chat box. Catherine, I'll bring you in before I give the update. Did you have a question?
Sorry, I was just going to say to Alexandra that, as you put it in the chat box, I've just realised you can't see it, that there is a Mind wellness action plan that is specific to home working, so that might be useful for you. And also we did a webinar about home working with occupational health and one of our lead OTs and people. That was, and we recorded it, and it's been quite useful and watched people.
Great,
wow,
thank you.
Thank you. And we are capturing the information in the chat box. I'm looking at Penny now, and we would put some bullet points when we send out the email and the recording on Friday. So I'd just like to say huge thanks to our entire panel today. And I'll just give you just a few highlights that will come out on Friday. Thanks for everyone that shared their update on their Wellbeing Guardians. So we're asking you again this week, can you just respond to us on if you have a Wellbeing Guardian? Please ignore if you've already provided the information. The Guardian role is a significant role. It will be a non-exec director who would look at the organization's activity from a health and well-being perspective and be a critical friend. But also they will support you as the health and well-being lead or whatever role you're playing in your organization. If you're not sure who your well-being lead is, please ask your chief people officer this week, who is our well-being lead? Who's our well-being guardian? And if you see your chief exec in the corridor, stop them and ask them, who is it? Have they been named yet? Have they been chosen? And obviously we want that person with someone who would have a passion for well-being, a passion for looking after our people, and come from diverse backgrounds as well. The other thing that we're collating, and this will help us as we move in to further work, is health and well-being. You've heard allies, you've heard champions. Christina will be delighted to know on the website, NHSI, it's saying well-being champions now, which fits better with the model, because we know many of you have your champions and many of you even have a role description. And what we want to be able to do is to continue to support our champions who may be part of your team, come from occupational health, they may be your trim practitioners, they may be your mental health first aiders. So we want to look at how that will be developed. So don't worry too much about the name, it's the delivery of the role. And we ask if you can give us numbers in the first instance. The health and well-being conversations, I know we talked about it, and Roz in particular brought that out. There is a launch for a discussion on the 11th of March. I have sent the email out, I can send it again, and that's to co-design what that would look like based on what you're already doing in your organization. Carol and Penny going to that and will feed back. But there are a couple of key things. There is bite-sized coaching, and it's on the website for our people this winter. It's a short, focused, single 45-minute session. It's free and it's with external coaches, and it's open to all our colleagues in health and social care. So we will send that out again. But there is something about leadership restoration group. And again, we have external facilitators, and it's designed to offer a safe space for leaders to talk openly about their experience. And who is a leader? We are all leaders, people who are supporting people. So, you know, they'll have feelings, concerns, they'll find mutual support from colleagues. And obviously it's to help reduce the buildup of stress and increasing a sense of well-being through nourishing. So those are some of the highlights. We can't show it today, but we have a video which we will send the link. It's 16 minutes. And it will show you all the work that we've been doing to support across the region. So you would have heard Eric talk about Vigo. There was funding nationally for that. You would have heard Angela talking about the videos that she's working on in CCAM. There was funding. So we'll give you a rough the breadth and the length of the work that we're doing together, but actually what are we doing in the region to support? And some of that is about the BAME work, some of that is around the work for LGBT, disability. There's a range that we cannot just do in this 1 hour. So we will send that link, and we're asking you as you go back to your organizations, can you share the weekly information with your comms leads, with your leaders, with your managers, with your team? And you can also link perhaps our webpage into your webpage as well, because as someone was saying, communication is the key. One of the learnings from Wave 1 was we had all this fantastic work going on. When we did the evaluation and the national stockade, a lot of the information, a lot of the resources weren't taken up. And some of it was because people just could not assimilate. So some of the new resources will be about mindfulness. Some of them will be about parents and carers, because a lot of us are parents. We've been homeschooling, and that can impact on our well-being. So the website will be very clear with the different areas. So that's a round robin. And I just want to say thanks to our panel and thanks to all of you for coming today. And hopefully it's been informative. If you have access to the chat box, please give us any feedback. We will be coming out to you for some feedback, and have a think about going forward, how often do we need to have these sessions?